Thank you very much, and we'll begin again with one of our wonderful students. So thank you.
So hello, everyone. My name is Samantha Simmons. I'm a second-year MBA student at MIT Sloan School of Management. And while at Sloan, I founded my own company called Curative Orthopaedics. And the company really began with my own personal story. So in college, I competed in track and field. And during my junior year, I fractured my back. And as a result, I had lingering chronic pain issues. And specifically, I found that my pain was always worse at night. So at night, the day's distractions were over, inflammation had set in, and I was just left alone with my pain. The one therapy I had, I could take pharmaceutical treatment, but that wasn't good for long-term use, or I could just do nothing and then suffer a restless night's sleep. So there really weren't too many solutions on the market available to me. And then over time, I began to develop my own solution for the back pain. So what I would do was I would wrap myself in a heavy blanket at night, almost like a straitjacket, and then fall asleep on an ice pack. And then it was something about the weight of the blanket, the compression, and then the cooling of the lower back that actually helped to ease my pain. And then independently of that, I began acupuncture treatments, which were very beneficial as well. And I thought there was a way to combine some components of acupuncture with my nighttime therapy into one product to help treat other people who experience chronic back pain. So with that, we developed Back to Sleep, which is a therapeutic garment designed specifically for sleep. It incorporates some of the components that I just discussed. So the first component is weight. So you'll see on this mock-up a quilted material on the top and then the bottom. So that's where the weight is. So the weight is sewn into those squares using black sand, which is a malleable sand. And then the midsection is just a compression belt. So moving forward, you'll see that it opens around the center, and then the entire material is actually made up of a neoprene fabric, which what's really nice about it is it's soft, it's light, it's kind of a jersey fabric, so it's malleable and it fits to the body. And what's nice about that is for manufacturing purposes, one material, and then moving forward, because of the fit, we can have 2 sizes for women, 2 sizes for men. So the last component is a pouch in the lower back for either an ice pack or a heating pack, which sounds very simple, straightforward, nothing novel, but I don't know if any of you have had an injury that you try to ice at night and you have an ace bandage around it, then halfway through the night, the ace bandage slips off, the ice pack's on the other side of the bed, and your sheets are wet, and it's a mess. So this is a very simple solution for that, and then all of these components are combined into one comprehensive treatment system, and all the components are scientifically proven to help reduce pain, to help relax, relieve, and revive the back. So looking at the actual target market for this, so I'm targeting chronic back pain sufferers and people that have trouble sleeping at night. So why this intersection? So there's a cyclical process. So the more pain you're in, the harder it is to fall asleep at night, and then with a poor night's sleep, you have less energy to fight the pain the next day, and you're depriving yourself of that deep sleep that's necessary to actually restore the muscles and help heal bones. So this product actually then tries to break this vicious cycle. So looking at the market as a whole, back pain is a huge market. It's the #1 reason why people go see their family doctor. It affects more than 19 million people in the United States alone. We found that doing our customer research and then just looking at published scientific journals around back pain, that at least 50% of people that experience back pain have trouble sleeping at night. So that breaks it down to a $10 million market, or 10 million people market. So just looking kind of at some testimonials, we went out, we talked to people that experienced back pain, and some of the things that come up again and again is time and lack of energy. I interviewed one 27-year-old who had back pain for about 5 years, and he said that just doing stretching for 5 minutes before bed helped his pain, but just to find that 5 minutes and that energy to do that 5 minutes before bed was hard. So what our product does, it's a therapy designed for sleep. So the user puts on the vest before bed, and the therapy happens at night. So, why spend money on back pain products? Well, people who are in pain are willing to spend money to get out of pain. So people spend thousands of dollars on a mattress, thousands of dollars on a zero-gravity recliner, $150 just on a support pillow. So there is a willingness to pay for something like the Back to Sleep product. Now moving on, looking at the competitive landscape, so we have Back to Sleep in the right-hand corner, and kind of comparing it to what's out there. So it's the only product that's designed specifically for sleep, has components of acupressure, is comfortable, And it's also just a holistic approach to back pain. So the braces that are out there are designed for specific areas of the back, for example, the lumbar spine, or for scoliosis, or for posture. This is just a holistic treatment for chronic back pain designed specifically for sleep. And if you look at the price point at $400, which actually seems high, but in the landscape, the competitive landscape, it's actually reasonably priced. So in looking at the manufacturing cost, so we think we can get this down to around $50 per piece for manufacturing, which compared to selling it at $400 is an attractive gross profit. And then the strategy, how are we going to get it out to customers? So we're going to do a B2C strategy. Because it's a Class 1 medical device, it's non-invasive. We don't actually need FDA approval to get it out there. We are going to do a product efficacy study, which we're preparing for right now. But our plan is to sell it online at our website, advertise on well-known chronic pain sites, do television commercials on QVC, Comcast Sportsnet, things like that. And then in the first year, 2 years, we're going to actually rely on physical therapists to get their recommendations to drive customers to our website. And this, we have already started we've started talks with physical therapy centers, for example, Spalding Rehab up in Boston, who showed interest in our product and actually incorporating it into the physical therapy routine of their patients. So then lastly, talking money. We're looking at a $200,000 investment. So then by year 5, that would be kind of an NPV of around $7 million. And so we got at this number with thinking that we can create or get sales of around 300 units in Q1 of year 1. And this is just from doing market research, talking to physical therapy centers, looking at their patient population who would actually be candidates for this brace, and then ramping it up by 10% each quarter. So that's it. We are, like I said, we're preparing for a trial that we're going to be doing in the next month or 2. And we have prototypes here. So in the innovation discussion at the end, please come up, ask questions. I'd love to hear from you. Thank you.